everyone, and welcome to another session of the Seamless Connection podcast. I am thrilled to have with me here on this summer Friday, Peter Shen, the head of digital health and automation at Siemens Healthineers. Peter, thanks so much for joining me.
Yeah, super excited to be here, Meena. Thank you so much.
I've read several articles that you've written over the last few years about AI, and I'm really looking forward to diving into that much more with you today, as well as talking about some of the healthcare technologies and changing care models you're working with. But first, I'd love to introduce you more to our audience in terms of understanding how you got to where you are today and understanding your healthcare journey. So, what first got you into healthcare, and what took you from point A to where you are today?
Yeah, no, great question. So, like you said, I'm Peter Shen. I'm the North America head of digital and automation for Siemens Healthineers, and I've been at Siemens here for over 25 years. And I guess my career is really focused on the introduction of new and emerging technologies in the healthcare market, and including technologies like artificial intelligence and whatnot. So, I grew up with my dad was an engineer and my mom was a medical technologist. So, kind of like these topics of like science and technology, were kind of very close to me early on. And then I had a chance to go study at Johns Hopkins and in biomedical engineering and learn a little bit more about how healthcare and engineering come together and all that type of stuff. So it became kind of a natural fit. And then certainly afterwards, then got together with Siemens and started my career actually first in the space of imaging and radiology, because back then, 25 plus years ago, radiology was actually making its transition, its analog to digital transformation, moving from like X-ray films into kind of digital images of X-rays. So that was a really fun time to be in healthcare and see kind of how healthcare evolved and started to adopt technologies like digital technologies here. So that was kind of how I got started, and have stayed in that area ever since, and have explored everything from not just artificial intelligence, but like data analytics, digital ecosystems, digital twins, a lot of different fun topics just on and how they all have an impact on our healthcare on a day-to-day basis.
That's amazing. And I really want to get into digital twins in a second here, but first, let's talk AI. Generative AI is receiving a ton of attention these days, and I believe there's a lot of low hanging fruit in the healthcare system that could be addressed by simply giving providers the right data when and where they need it. But we still have a long way to go in just automating these processes to drive more efficiency. So, what do you see as a low hanging fruit that AI can solve for healthcare in the near term? And related to that, what's stopping it?
Yeah, I think a lot of folks, Mina, are really excited about artificial intelligence. Certainly, I think large language models and stuff like that have, and generative AI have really kind of attracted a lot of attention with folks around AI and what's possible with AI in healthcare. But I think what a lot of folks don't realize is that artificial intelligence already has and is impacting healthcare today. So simple models, simple AI models or machine learning models there are actually built into a lot of our healthcare processes and procedures that are happening today. So as a great example is the technology that you and I are well familiar with in our personal lives when we take pictures with our phone and whatnot, and it recognizes, oh, this is a picture of Meena, or this is a picture of Peter. We use that same technology, that those same machine learning models there, to actually also recognize anatomical structures. So patients who go in, let's say for an MRI of their knee or of their shoulder, we use those same pattern recognition tools to recognize, oh, this is Peter's shoulder or this is Meena's knee. And we actually then are able to properly position the patient in that MRI device so that we get the best image of that knee or of that shoulder for that particular patient. So that's happening already today. And then certainly other AI algorithms are in place today that help clinicians like identify, let's say, nodules or cancerous tumors that a patient might have. So a patient that comes into the hospital or the ER and they're complaining of, let's say, chest pain or having difficulty breathing, a simple chest CT examination with the help of AI algorithms are able to identify, let's say, maybe cancerous lung nodules, or maybe, let's say, blockages within the patients that, let's say, a heart or something of that sort, or maybe even some fractures within their vertebrae. We can run these AI algorithms at the same time as that patient is getting that chest CT exam to see what's wrong with them. So we can use AI to help actually triage maybe some of the challenges that patient has. And then even from a therapeutic standpoint, AI is helping patients get their treatments faster. So patients who unfortunately are diagnosed with cancer, some of those patients actually then go through a process maybe where they're going to get radiation therapy. And in those particular instances, we want to make sure that when we shoot that radiation towards that cancer, that we're actually hitting the cancer and preserving the healthy tissue that's around that cancer. So what a lot of physicians have to do in a very tedious manual task is actually go in and actually segment out or actually draw out the surrounding tissue around that cancerous tumor. And if you think about it, if you try to do that on your computer with your mouse and trying to draw that kind of that shape around that tumor, it's a pretty tedious task. And then if you realize that actually, well, this is a three-dimensional cancerous tumor, so I've got to kind of do that drawing or that segmenting with each plane of that particular tumor. And unfortunately, that tumor is kind of an oblong shape that's not a perfect sphere or perfect cube or anything of that sort. It becomes really difficult to do that on a manual process. Now you introduce artificial intelligence and the ability to automatically do that segmentation for you in a matter of seconds versus what would take manually maybe hours or sometimes days. You can actually then prepare that radiation treatment plan for that patient almost right away. And that allows those patients to be able to get their care and their treatment almost immediately versus having to wait days or weeks before they can actually get that treatment through a manual process. So these are kind of like low-hanging fruit things that are happening with artificial intelligence in healthcare already today. It's really benefiting patients directly with the technology that's embedded into our healthcare system today through AI.
That's amazing. And one of the key pushbacks we'll get with anything new coming into healthcare is cost, 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 cost. And one of the questions that we'll get about AI or any new, innovation really is, how does this help while still reducing costs, or how does this help while still increasing operational efficiency? So you've talked about operational efficiencies a little bit, but can you share some examples of how AI has driven efficiencies and improved workflows for frontline care team, resulting in actual measurable cost savings? Because when you talk to hospitals, they're like, oh, that's fuzzy math, right? And they don't give you the credit for it that they would need to get past their budget committees or what have you. So
Yep.
what are the ways we can do that to concretely get that level of hard dollar ROI to show to people saying, hey, listen, this will increase your provider productivity, this will increase your patient throughput, and this is the actual number I can put on it.
Yep, I think there's a couple great examples, and certainly what you touched on, Meena, is a real challenge that AI in this particular industry has right now is really trying to quantify what is the downstream benefit of introducing a technology like artificial intelligence in the healthcare space. But if you go back to that example of those patients that are waiting for their radiation treatment plans and the ability to shorten the time it takes to actually create those plans so that those patients could actually get their treatment started in a mere matter of, let's say, hours or days versus weeks or months, that has tremendous downstream savings for that patient in terms of not only their costs, but also the time that they have to take and endure while they're going through this treatment or whatnot. Some of the other cool things that we're doing that has some direct effect is we're looking at how we can utilize artificial intelligence to help kind of predict the need to actually do some of these kind of invasive procedures. So a great example is in the area of prostate cancer. So what we're looking at is there a way, for those of you who aren't familiar with prostate cancer, it's in some cases it's a slow growing cancer. So in many cases, a lot of males who are diagnosed with prostate cancer, they end up on what we call active surveillance, which is we're basically kind of waiting to see what will happen to that cancer. Will it grow quickly or something like that before we actually decide to do some sort of invasive procedure like surgery or radiation therapy for that cancer. So in many cases, what during that active surveillance process, like we'll have to biopsy the prostate every, let's say, 6 months or so, just to kind of see if that cancer's evolved anymore or whatnot. With artificial intelligence, what we're looking at now is there a way that I can use, let's say, multi-parametric MR imaging and combine that with the lab results of that particular patient to actually predict whether we actually even need to do that biopsy on that particular patient. So with the help of AI, I can actually predict, okay, well, wait, I don't need to do that biopsy on this patient 6 months from now. Maybe I can actually wait a year. Maybe I can wait 2 years before I actually have to do that invasive procedure. So you think of what that downstream savings is one is I've avoided having to actually do this invasive procedure and the costs associated with that invasive procedure. But then I've also eliminated maybe the necessity to have some of these kind of follow-up exams or discussions with that patient for a period of, let's say, an additional 12 or 18 months or so. So tremendous savings, yeah, in terms of not just time and efficiency, but also in terms of overall cost of care related to that particular patient in that particular situation. So those are great examples of how really AI could have this profound effect, not just in terms of driving efficiency and time savings or whatnot, but also really having a profound effect for the patient and the overall cost of healthcare in general.
No, it's amazing. And let's go back to that phrase you used earlier, digital twinning. Can you tell us more about what exactly you mean by that?
Yeah, so it's an interesting phrase because we've given all these examples, about how AI kind of given an individual task, will have some sort of benefit, whether it's in terms of helping with diagnosis of the patient, or maybe, let's say, a specific therapy, like we were talking about radiation therapy or whatnot. But where we at Siemens Healthineers see the biggest potential for artificial intelligence is really kind of what I would call like multimodal AI, which is really now taking multiple pieces of clinical information together. And if you can bring all those pieces of clinical information together, let's say like imaging data plus, let's say, pathology data, and let's say laboratory data, or even genomic data about that patient, if I can bring all that data together and then overlay a technology like AI on top of it to find correlations within all that data, I actually then have the opportunity to make maybe a more informed diagnostic decision, or maybe a more personalized therapeutic decision about that patient. So the ability to kind of combine multiple pieces of clinical data together is where we see the greatest opportunity for a technology like artificial intelligence. So that's where we're focusing a lot of our attention on. This is where we're enhancing some of our different AI algorithms, like that prostate prediction algorithm that we talked about earlier. These are some of the things that we're working on today. But now, if you think a little bit further, if I have the ability, if I've collated kind of all this clinical data about the patient here, I can actually start to model what kind of almost like a digital twin or a replica of that particular patient. So I can actually maybe, let's say, create kind of a replica of certain anatomical structures about the patient. So I could actually make, like, let's say, a digital twin of the patient's heart, because I have the patient's imaging results. I have kind of maybe their lab results. I can look at kind of like the physiology and the circulation and the biomechanics that are an electrophysiology that's associated with that heart. I can actually start to model with artificial intelligence help how that heart might react to certain types of treatments. And by doing that, by creating kind of this digital twin of the heart, I can actually start to test different therapies, let's say, for a patient who might be suffering from like arrhythmia or something like that. And I can actually use that kind of digital twin and test these different therapies to find what that optimal therapy is to take care of that patient's irregular heartbeat. So if you think about it, it's almost like kind of creating that high school science experiment,
Yeah.
right? By being able to kind of create now in this virtual environment kind of this digital twin, I can test different types of therapies, figure out what's the best therapy for that individual patient, for that in this kind of virtual environment, and then I can apply that then therapy or that treatment in the real world to that patient, and hopefully have a high level of success in terms of treating that patient. So that's the excitement of kind of creating kind of this digital twin, is I can actually figure out what is that optimal therapy for that individual patient. And then if you will, if you could take the idea a step further, is that with that digital twin, not only could I figure out what's the best therapy or what's the best way to take care of a problem, but I could actually now reverse the whole thing and actually use that digital twin to figure out how do I do preventative care. So how
Mhm.
do I instead, how do I make sure that that patient doesn't have any sort of abnormality or doesn't have any sort of disease? So is there a way, if I change the patient's diet, their exercise, this or that, how will that heart, or how will that patient, how will that digital twin react if I change something associated with that patient's environment, or the way that they're taking care of themselves? And we can see how that reacts in this digital twin world to maybe figure out what's the best way to provide preventative care for that patient going forward. So that's what's really exciting about digital twins, is the ability here to really figure out what is the optimal way to care for the patient going forward.
And that's super exciting. Now, one of the concerns that comes up is you and I live in these major metro areas. We have a lot of resources around us, a lot of high tech areas around us. What about accessibility for
Yeah.
maybe the people that don't live in a major metro area, that don't have, a tier one academic center, in their backyard,
Yeah.
or three of them in our case.
Yeah.
So are some of these technologies, which I can easily see the potential. I mean, what you were talking about with prostate can easily be applied to breast cancer or to lung cancer or
Absolutely.
to, a number of different things. Um, but is that accessible to anyone? Is there a certain level of academic institution that would only be able to do it? Or at what level can AI be pushed to the broader population so more people can benefit versus really this is a niche solution for, a subset?
Yeah, it's a great question, and I think you and others are starting to realize this. Once you sit down and you realize, oh wow, artificial intelligence, especially in healthcare, can be this great game changer and really be able to benefit patients everywhere. You start to realize that, wait a second, patients have heart attacks and cancers and stuff like that. Unfortunately, not just in the big cities, but they also have them in kind of rural and underserved populations as well. And so if you start to realize that, you start to see that actually those patients actually could really benefit from this type of care, because to your point, they don't necessarily have the accessibility that of let's say a tier one academic medical center in their backyard. But if you could have tools that are able to help them diagnose particular disease faster, or be able to personalize treatments faster, or make them more personal for the patient, these would be tremendous benefits for all patients, especially those in kind of rural and underserved areas. So for us, it's a big mission for us at Siemens Healthineers, and for me personally, to try to figure out how do you actually make a technology like our artificial intelligence accessible to all patients. From our perspective, that means also driving the overall adoption of this technology by different types of healthcare providers. So not just academic healthcare centers who have the ability maybe and the budgets to be able to do this type of investment, but also trying to figure out ways that, let's say, the community hospital that you and I go to in our backyard also has these great technologies available to benefit their patients. So one way that we're trying to look at that here at Siemens Healthineers is how do you drive adoption? Is unfortunately with today's U.S. healthcare system, it's driven through reimbursement and kind of the reimbursement of costs that are associated with healthcare. So what we're trying to do is we're trying to advocate with folks in Washington and other areas that the importance of actually providing some sort of reimbursement to these AI tools that are really providing some sort of quantitative and quantitative clinical benefit for the physician and for the patient. So all these examples that we talked about in terms of identifying cancerous nodules and being able to more quickly create radiation treatment plans, or avoid unnecessary biopsies. These are all providing a bunch of different quantitative and qualitative clinical information that in many cases the clinicians themselves don't have the ability to calculate or figure out, or would take a bunch of time to be able to do that. And so what we're really trying to encourage folks in Washington, the different folks who are creating policy and the folks who are also creating kind of the reimbursements associated with that policy, is to say let's also reimburse or reward providers who are actually using this type of technology that's really helping them make clinical decisions. And ideally, what we're trying to do is trying to remove kind of the barrier associated with costs, because we see that as an important way to kind of equalize the playing field and allow then all providers, whether they're in large academic institutions or smaller places, to be able to adopt this technology. Unfortunately, today, one of the challenges is that even though there's more than close to 900 different AI algorithms that are approved by the FDA, so they've gone through a process where they've been vetted, and we know that they're safe to be able to utilize to help make clinical decisions. Only a mere handful of those AI algorithms are actually getting any sort of additional reimbursement associated with the clinical findings that they're able to generate. And unfortunately, even of those few that are getting reimbursement, many of them are getting reimbursement much less than the overall cost of the technology itself. So one of the challenges that happens today in terms of adoption is that providers are really challenged, because they see all these benefits that we talk about around artificial intelligence, but they have to make this now financial decision on whether they actually want to make an investment in this technology or not, and making that investment with maybe the knowledge that they may or they may not get any sort of reimbursement associated with that technology. And so certainly maybe some of the larger medical centers and health systems who maybe have a little more financial flexibility are willing to take that risk or that gamble to say, okay, yeah, we'll invest in this technology. We believe it's helpful for our patients, and we can kind of make that bet that we maybe get reimbursement, or maybe we don't get reimbursement. But if you go then again to the small community hospitals and kind of the rural and underserved populations, they don't necessarily have that financial flexibility to make that type of decision. So it becomes really difficult for them. So what we've been advocating is to try to get folks like at CMS and the folks that are putting together like Medicare and Medicaid to really try to provide kind of more consistent and predictable reimbursement associated with artificial intelligence. Because with that predictable and consistent reimbursement, then all providers will have a little more confidence knowing whether they can make that investment in AI or not. And we believe that if we can kind of drive that investment, that drives the overall adoption of artificial intelligence here, also motivates then the private payers to also maybe also look at kind of reimbursing artificial intelligence, and in general drive the overall adoption of this technology so that it gets to the hands of the people that will benefit it from it most, which are the patients that are out there.
Yep. No, that makes complete sense. Money does make the world go round, unfortunately, and especially these days
Especially in
with
healthcare,
budget
unfortunately.
deficits everywhere. What have you learned? One of the amazing things about your role is that you've seen how Siemens has been able to do things and drive success around the world, not just in the US. And I know you're head of North America, but you've seen what they've done in the EU, in the Middle East, in Asia. Are there any lessons for us to take away from those locations that we should be thinking about or considering pulling over here, whether it's with AI or imaging, or more broadly, just how we think about without getting to the politics of healthcare, just
Yep.
thinking about how we are as a system today.
No, I think we have the great fortune, as you said, to be kind of this global company. Yeah, we've got 71,000 employees worldwide who are all focused on trying to create innovations within healthcare here. And I think one of the big things that myself and my colleagues all learn, kind of looking at the different healthcare markets that we have, is that to really make technology in healthcare impactful for the individual patient, you really got to look at, and this is very applicable, especially around artificial intelligence, is you really need to look at the patient population that you're serving, and making sure that technology is applicable for that particular patient population. And this holds very true when we talk about artificial intelligence. As we acknowledged earlier, AI is really driven by, and these algorithms are really created by data, and being able to make sure that data is not just accurate and sound and all that other stuff, and maybe minimizing biases and all that. But what's very important is making sure that the data that's being used to train these AI algorithms is actually reflective of the patient population that's going to be applied towards.
Mm-hmm.
And this is something that we've learned as a global company, where when we created some of our initial diagnostic AI algorithms, We created those algorithms where they were trained, let's say, on data of let's say like European and North American individuals. And when we took that same so when we created that algorithm and we started using it in those particular markets, of course it performed very well. It was very accurate. It was able to diagnose very well, all that type of stuff. But when we take that same algorithm and we brought it to, let's say, our Asian market, no surprise, it actually failed miserably.
Yeah.
It was very inaccurate. It couldn't find a lot of stuff, and it was a lesson that we even realized that, wait a second, when you train these algorithms, you really have to train it with the data based on the patient population that you're going to apply it towards. So we essentially had to retrain our algorithms. To be reflective of the Asian population that we were looking at when we were going to deploy that algorithm in Asia. So these are things that that you have to be mindful of. So everybody talks about how we got to minimize biases. We've got to make sure the data is accurate and everything. But a big tenet for us is really making sure that the data that's being used to train these algorithms really is reflective of that patient population that you're going to apply it towards, and keeping that in mind as you develop these AI algorithms, we believe is not just a responsibility of the folks that are using these AI tools or creating policies around these AI tools, but it is also a responsibility of us as an innovator of these tools as well, to be mindful of kind of these tenets as we develop these type of algorithms going forward.
And this is something that I know the pharma industry has faced now, for many years. But I think there's been actual legislation from the FDA to require, like clinical trials, for
Yep.
example, to have X percentage of the population represented based on the drug and indication. We don't really have anything like that for AI yet. Is there something like that in the works, whether it's through CMS or HHS or something maybe industry led, to say, hey, these are the guidelines we're agreeing on that has to represent X, Y, Z, measures of the population, or any, to exactly your point though, which is garbage in,
Yep.
garbage out, right?
Yeah.
So how do
Yeah.
you protect against that from a more
Yeah.
standardized way?
Yeah, certainly. I mean, I think folks in Washington and other places are trying to figure out what are the right policies that you need to be put in place. That not only is minimizing biases within artificial intelligence, but also addressing topics like patient data privacy and whatnot as well. I think the FDA already. If you think about the FDA, healthcare actually is, as much as everyone talks about, oh, we need guardrails around AI and all this and stuff like that. Healthcare, if you think about it, is already a very highly regulated industry as it is, and
Right.
the FDA actually has done a very good job, even with those some 900 different AI algorithms that have been approved. They've done a very good job in terms of making sure that each one of those algorithms have met the stringent requirements that are there in order to apply them towards patients. And so we respect all of that, and certainly we can't predict where policy is going to go. So where we see an important aspect is also to bear some responsibility ourselves as an innovator, as an innovative company, to really establish kind of guardrails within our own organization, that holds ourselves accountable from an AI principle standpoint. This is why we have principles in place which really look at, again, the data that's being used that's reflective of that patient population, also respecting the relationship that the patient and the physician has as well, and that technologies like AI aren't there to replace the physician in that relationship, but really are there to really augment that relationship, or be that kind of that backup person to that physician that substantiates a lot of the decisions that they're making from a clinical standpoint for that particular patient. So see, these are some of the kind of tenets that we hold ourselves accountable for. Also respecting patient data privacy, making sure that any of the data that we're utilizing is really truly reflective, not just of the patient population, but also truly reflective of the clinical disease that we're looking at there, that's been fully kind of de-identified from any sort of patient identifiers that are out there as well. So these type of tenets that we have here are part of kind of the responsible AI that we believe as an innovator as someone that's creating these type of solutions that we've got to hold ourselves accountable for. And we're encouraging our other colleagues in the industry to also establish kind of responsible AI kind of tenets in place as well, and hold themselves accountable, because this is what's going to be needed in order for AI to be successful in this kind of healthcare environment that we have.
No, and I'm really glad you brought that up in terms of the fear of AI replacing the physician or taking that physician role. As you know, that's not just for physicians, it's across any industry, right? The
Yep.
fear is that AI will take away jobs. Um, and so, especially in areas like radiology, where there's been AI has been there for a while. There's been a lot
Yep.
of work, a lot of development. So, what impact do you think AI will have in, for example, the role of a radiologist in the future? Or how do we protect that job, if you will, right? And make sure it is an augmentation of
Yep.
the in-person physician as opposed to a full replacement of, which, don't get me wrong, there are times and places for that when the physician's not available and we don't have enough physicians, when they physically can't get there in time. Totally
Yep.
see how it could be helpful, but when the physician is there, or how do we make sure that we're not losing that in-person resource?
Yep. I think you touched on it first, Meena, which again, I think people realize this. I mean, we have a workforce shortage within healthcare, so we're challenged as it is today with the number of clinicians, radiologists, technologists, nurses that are available to take care of patients going forward. And the demands for healthcare are going to continue to grow, obviously, with an aging population and whatnot as well. So quite frankly, like we can't afford to replace anybody within the healthcare workforce right now, because we need every single one of those warm bodies to help take care of patients and whatnot. So again, artificial intelligence for us is not a tool or solution that's going to replace anybody. It really is there to augment kind of that clinical decision. And for us, I mean, we've purposefully even marketed our solutions as AI companion solutions, because those are solutions that are there to be the companion to in this case, radiologist, when he or she is making a diagnostic decision by looking at these images with the help of artificial intelligence. So we see again AI being kind of that technology that's backing up the clinician in his or her diagnostic or therapeutic decision making. So really being that tool that helps that clinician and substantiates kind of the decisions that they're making for their particular patients. So we don't see that as any sort of replacement at all, but really again augmenting kind of the decisions that they're making. Now, in order for that to happen, it's important, I think, not just to just say, oh yeah, this is just a tool and here's how you use it, that type of thing. But we actually make the effort to make sure that the clinician understands the rationale behind the decisions that the AI tool is making, or the conclusions that the AI tool is making. So it's very important for us when we introduce our AI tools to the clinician and roll that into their routine clinical workflow. It's more than just showing them, here's where you click and here's how you use the tool, but really for them to understand what's the rationale or the reasoning behind the AI algorithm making the clinical conclusions that it's making. Like, why did it say that this is a malignant nodule, or why did it say that this is bad or this is good? So really taking the time to make sure that the end user, in this case the clinician, really understands why the AI tools made that particular decision.
Mhm.
And for us, that's a really important aspect for making sure that the clinician understands, and then also has confidence in the AI tool being something that could help him or her in their decision making. So if they really understand the rationale, so really remove kind of the black box that's associated with this AI algorithm, and really help them understand, here's the rationale, here's the thinking behind the algorithm. This is why the algorithms made that particular decision or that particular conclusion. We see that as a really important aspect to the overall adoption, successful adoption of these AI algorithms.
Fantastic. And I'm going to close with two diametrically opposed questions. So the first is, what concerns you the most about AI and all the potential that it holds? Like, where can you see it going really, really wrong? And the follow up to that is, Obviously, we're not hoping for that outcome, but we're looking at kind of, in the next few years, let's say in the next 5 years, just like we can't imagine life without our, smartphones today. What version of that do you see for AI where it's so embedded in our day to day, whether it's with healthcare or otherwise, that we just can't imagine a life without it?
Yeah. Yeah, I think that the biggest concern that I have, it kind of as this technology evolves is certainly, there's a lot of interest in terms of this technology and really trying to make sure that the proper guardrails are in place for that technology and whatnot. And I think while that's very important, and we've got to make sure that we do have established guardrails. And in some cases, as we talked about earlier, those guardrails are already established for certain aspects of AI. But maybe for some other aspects, some work needs to be done in that area. There has to be a fine balance in terms of how this is all handled, because you don't want to over create policies that maybe overregulate or prevent any sort of innovation happening around this type of technology. So we have to work very closely as an industry with policymakers to figure out what is that right balance that makes sure that there's confidence in the way that this technology is being integrated into our daily kind of healthcare system, but at the same time, still allow folks to continue to innovate this technology and be able to kind of figure out what is the next thing that's associated with like artificial intelligence, and making sure that AI still has the ability to grow and innovate, and so that the algorithms that we put out there have the ability to still be improved upon without being caught up with all the different policies that are in place or whatnot. So that's a real key component, is making sure that we strike the right balance between kind of regulation and innovation, and that's a key component, especially for a technology like AI. Um, where it could get exciting, I think, is what we talked about earlier, is the fact that if I can use this technology to actually start to replicate and create kind of digital twins of patients or patient anatomical structures here, and really figure out optimal treatment plans or optimal ways to do preventative care, this could be really amazing and really a game changer for us. I think us as individuals may then maybe have more interest in our own individual health if we have kind of this digital twin of ourselves readily accessible. Let's say it is on our smartphones or anything of that sort. I could see an opportunity where then individuals now take more ownership of their healthcare, because they know they have the ability to see kind of how all these different things affect their healthcare, affect maybe the way that they might get treatment for things as well. So the consumerism of healthcare combined with kind of technology like that we're talking about here, the possibility of digital twinning here creates, I believe, a lot of possibilities where you could see strong ownership from individuals about their health going forward, which I think is excellent. It's a great opportunity then for all of us to be more involved with our own healthcare here, and to be more informed with how the different things that we do might influence how our health is going forward.
Well, Peter, thank you so much for sharing your Friday afternoon with me. Really enjoyed the conversation. I'm looking forward to seeing what Siemens comes out with next.
Yes, appreciate it, Meena. Thanks for the questions. It was great having me chatting with you here.